Welcome back to WDHN Daytime. We are now joined via Zoom by Dr. Ann Schmidt. She is the medical director for Blue Cross Blue Shield of Alabama. Thank you for joining us.
That's right, and good morning. Good morning, Dr. Schmidt. And you are here today again to talk about the statewide efforts in order to raise vaccination numbers called We Can Do This Alabama.
Yes, absolutely. We definitely want to let people know about We Can Do This Alabama, which is a campaign that's sponsored by the Alabama Department of Public Health, the Alabama Hospital Association, and of course, Blue Cross Blue Shield of Alabama. People who are interested can go to the website, which is WeCanDoThisAlabama.com, for more information about how to sign up to be a community champion, to talk to 3 people a week for 4 weeks about the vaccine, and to help sign up 5 other people to also become local champions.
All right, and obviously an effort like this goes because of the numbers in Alabama. Kind of speak to some of the things that we rank not so greatly in terms of getting vaccinated.
Absolutely, that's correct. Unfortunately, we've remained at or near the bottom when it comes to percentage of our population that's fully vaccinated. Right now, we're a little over 36% of Alabamians have received both doses of the mRNA vaccines or 1 dose of the Johnson & Johnson vaccine. So the more we can get the word out, the more we can encourage people to ask questions, to talk to their physicians, the better off we'll be.
All right, and a big question at home is, even if you have both doses, will you have to get a 3rd booster shot? What can you tell people who are watching?
Yeah, absolutely. So right now, a 3rd dose is recommended for some folks who have compromised immune systems. That might mean someone who's had an organ transplant, maybe someone who has HIV, someone who's undergoing treatment for cancer. So as of right now, those are the people who a 3rd dose is recommended for. And as always, if you think this might be you, definitely talk to your physician or your healthcare provider to see if the 3rd dose is appropriate.
All right, and I think we've seen it very much widespread here in the Southeast and a lot in Alabama is ERs and the overcapacity of ICUs and the lack of beds. So what can you tell people at home, whether they are dealing with symptoms of the virus or have it themselves, when can they kind of decide when it's acceptable to go to the ER versus can I mitigate this on my own?
Yeah, that's a great question. So we definitely want to save our emergency rooms and our hospital beds for those folks who have severe symptoms of COVID. So that would mean if you're short of breath, if you're having trouble catching your breath, if you have a high fever, or certainly if you have other concerns about your symptoms, you would want to go to the emergency room. What you wouldn't want to go to the emergency room for is a COVID test or for milder symptoms if you're wondering if you have COVID. Those would be the times to reach out to your healthcare provider to see if they could provide a test for you, if they can give you other advice about where to go to get a test, and they certainly can answer other questions that you would have.
Okay, and we've heard so much about antibody therapies, but in particular, monoclonal antibody therapy. Explain that, really break that down for our viewers.
Yeah, absolutely. So monoclonal antibody therapy is a treatment that can be given in an outpatient setting, meaning that for someone who's not hospitalized, for someone who doesn't have those severe symptoms of COVID enough to be in the hospital, it's a treatment that can be given in a physician's office, either through an IV or subcutaneously, through a shot under the skin. And this is indicated for people who either test positive for COVID and are at risk of having severe reactions or severe symptoms, or it's also indicated for people who have been exposed to COVID and who are at risk. So again, think of those people who have some immune compromise, maybe organ transplants, people who have cancer. So definitely something to ask your healthcare provider about if you think this might be indicated for you.
All right, well, thank you very much for breaking all that down. There's a lot of things I think you and I are still kind of confused as to what it is. So real quick, just give one more website where people can kind of get an overlapping information source of all this stuff.
Yeah, absolutely. So I'll give you a couple. Of course, the Centers for Disease Control and Prevention at cdc.gov is a great source of up-to-date and accurate information. And if you're interested in signing up in our own state to promote the vaccine and let folks know about it, it's WeCanDoThisAlabama.com.
All right. Well, thank you very much again, Dr. Ann Schmidt, for coming on our show. You've been on it once before, so nice to see you again. And I hope you have a great rest of your week.
Thanks so much. You too.
You're all right. Well, we'll be right back.